All right, well, let's go ahead and get started. Welcome, everyone. My name is Steve Schwartz with Concierge Medical Marketing, and this is our Concierge Medical and DPC 2025 Internet Marketing Plan. Our focus today is to help you learn what you need to make sure your goals are set and your plans are made and the techniques are in place so that you can maximize your practice's lead flow in 2025. My goal is to have this entire workshop completed in 1 hour or less. And I'm going to do my best not to read slides because everybody else can read, but I want to cover the main things. And we want this to be a great piece for you to use. I will provide a replay of the recording so that you can dig back through it again, as well as the slides and a workbook. So let's get started. All right, what is our agenda for today's workshop? We want to set clear goals and targets for the year. We want to help you establish your current, your patient panel size. We want to talk about your desired growth, what you're currently doing for your lead flow, and what are your goals for revenue. I want you to help get clarity for your current lead flow and make sure that the process you have in place will result in accomplishing your goals. And if it doesn't, we need to tweak some things. We want to discuss emerging digital marketing trends for you to consider implementing in your practice. We want you to get acquainted with the patient activity sources pyramid and why you need to get it right and to do it in the right order. And at the end, we're going to give you an opportunity for self-evaluation of your practice marketing. In other words, how well do you think that you're doing? Let's prepare your practice for massive growth in 2025 and beyond. Here we go. First of all, who am I and why should you listen to me? My name's Steve Schwartz. I've been in digital marketing and website design since January of 1999. That's over 25 years now. In my career, my team and I have created somewhere over 2,400 websites, and we've provided digital marketing to many, many clients. I'm also the author of the definitive guide to winning with digital marketing for concierge medical practices. And you're welcome to request a free copy of that book from our website, conciergemd.marketing. Also, I am the host of the Concierge Medical Marketing podcast. Now, who is Concierge Medical Marketing? Concierge Medical Marketing is an agency with the sole, Concierge Medical Marketing is a digital marketing agency whose sole focus is helping concierge medical and direct primary care practices achieve their business goals with effective digital marketing so that they can enjoy happier lives. And more successful businesses have more income, more personal freedom, and improve the patient outcomes. That's what this is all about, folks. At Concierge Medical Marketing, we offer 3 different digital marketing programs. The first is called Transition. This is where we help an existing insurance-based practice transition some of their patients to a DPC or concierge model. The second is called Growth. This is where we help a practice grow through digital marketing techniques to achieve the desired panel that they wish to have, whether it's 200, 300, 400. We want to help grow the practice and build a wait list. Finally, we offer a program called Nurture. Nurture is where we help to nurture existing patients so that they will continue to feel appreciated, continue to feel the love, and renew every year going forward. Now, here's a very important thing. We're busy. Everyone's got things going on. And if you're not able to stay on this entire workshop for the 60 minutes, that's okay. If you have to drop off, drop off. But I want to just come out of the gate and say, look, if you would like to have a free, no obligation, one-on-one discussion with me and members of our team to discuss your unique marketing situation, your Google rankings, your lead flow, your keywords, is your paid advertising working? What are your goals? Whatever you want to talk about related to digital marketing to grow your practice, we're happy to chat with you about it. Again, free of charge, no strings attached. All you have to do is visit cmmkg.com/schedule. And what you'll do is you'll schedule a 15-minute call with me. We'll get acquainted. We'll get an idea on a high level of what you're struggling with or what your goals are, or where you want to go. Then we will set a second meeting for a little bit later, a few days later, that gives me and my team members a chance to dig into your situation a little more, do some in-depth research and whatnot. And that way, at the second meeting, we'll be able to present some great strategies and ideas for you to help you grow. Does that make sense? Okay. So all that being said, let's get started. Now, if you haven't already done so, I encourage you to download your workshop workbook here. There's a picture of it on the right side of the screen, your 2025 Concierge Medical and Direct Primary Care Internet Marketing Plan. All right. You can download it. I recommend you print it out. Probably not time to do it now, but print it out, 3-ring hole, punch it, put it in a binder, take notes on it, and keep it because there's tons of great information in there. You can get to it from cmmkg.com/2025-workbook. And another thing I wanted to point out, I'm going to email these slides to you tomorrow. All right. So don't stress out if you missed something, if you didn't hear something, if I, mispronounced it, whatever. You're going to get the slides. You'll have the workbook. You're going to have all this. Okay. So no stress. All right, let's get into the meat of things. Number one, it's super important for your success that you need to set very clear goals for your practice. What are your goals for 2025? Realize that success is goals. All else is commentary. Brian Tracy. So here's a couple of things to think about when it comes to goals. What is the current snapshot of your medical practice right now? Okay, as of early 2025, what is the current number of membership patients you have? What is the average amount that they pay you every year as your patient? Thereby, what is your current annual revenue? Now, are you at your desired panel size? And if not, how many more patients do you need to reach your desired panel size? How many new patient leads come in per month? Do you know? What is your conversion percentage? In other words, the number of patients that actually become patients, members of your practice, based on the total number of leads that come in and based on the total number of meet and greet discussions. Do you know it? What does it cost your practice to acquire a new patient? Do you know it? I hope these are good questions. I hope they're tantalizing questions and it makes you think, and maybe even a little bit uncomfortable, because we need to figure out what your goals truly are. Now, in the idea of goal planning, what is your long-term planning for next year, 2026? Similar questions. What is the desired number of membership patients you want to have at the end of 2026? Maybe it's different, but what about the average amount paid per year per patient next year? What is your total desired revenue going to be? What is your desired panel size? By the end of next year, have you filled your panel completely? Do you have a solid waiting list? And here's another thing. If you're a solo practitioner office, have you thought about growing your practice by bringing on another MD, a DO, a PA, or an NP to help you grow? These are excellent questions that I want you to ponder. Finally, will you need more office admin staff, nurses, front desk? I don't know your numbers. You do. And if you don't know them, let's figure them out right now. We need to dig into your actual numbers, and based on your actual numbers, figure out if you currently receive enough leads to reach your desired annual goals. I've created a spreadsheet in Google Documents for you. It's called the Lead Generation Targets and Budget Planning Worksheet. Sharp just dropped the link into the chat. You can also scan, by the way, obviously I've got a lot of QR codes in here. You're welcome to scan if convenient. This is what the spreadsheet looks like, and we're going to work through this in just a moment. Now, the way this works is you get to the document by the link or scanning the QR. In Google Docs, you then save the document to your own account, and then you should be able to change the numbers in the orange boxes. Based on what you change in the orange boxes, the spreadsheet is going to automatically calculate your numbers, and feel free to change the numbers, add higher for this, lower for that, whatever, so you really get a good idea of what this looks like. Okay, I'm going to jump over to this budget worksheet and we're going to try some numbers to see how it works. Here's the worksheet. All right, so the questions that we have are some of the goals that we just went through. For example, how many membership patients does your practice currently have? In my spreadsheet, I wrote 50, but let's say, I don't know, let's say you have 80 patients right now. How many patients would you like to have at the end of this year, at the end of 2025? Well, I'm going to change my number to 160 because for this example, we want to double our patients. So the spreadsheet says this is the number of new membership patients that that need to be acquired by the end of the year to meet your goal. 80. Obviously, 160 minus 80 is 80. How many months remain before the end of the year? 11, right? February through December. Now, number 7 here, this is the number of new patients that need to be acquired each month. Now, the next box is talking about finances. What is your average annual membership fee per patient? I put in 3,000. Let's say, I don't know, 4,000. Talked to a physician the other day, 4,000 is their magic number. So if a practice has 160 member patients who are paying on average $4,000 per year, that means the annual revenue of that practice will be $640,000. This equates to $53,000 per month gross revenue. Now we're going to talk a little bit about lead flow. How many patient leads do you receive on an average month? And every practice is different. Let's just start with, I don't know, 10. And from 1 to 0, what is the percentage of average conversion rate from a lead to a signed up membership? For example, one enrollment in 5 would be 20%. So let's say you're better than that. Let's say it's 50%. Out of every 2 people that's a lead, 1 signs up with you. All right. Now, what it calculated for us right now is based on the number that you have, the number you want to grow to, how many months remain. It's going to tell you if you only are receiving 10 per month and you only close 50% of them, 1 out of 2, you will not receive enough leads to meet your goals this year. How many people are you missing it by? In this example, 2.27, which to me sounds like 3 people, right? Now, one final thing, how many years do you expect a membership patient to stay with your practice on average? I put a number here, 5, maybe 4, maybe 7. Whatever you want to do, you can change the number there. But based on $4,000 average per year, and let's say 6 years that the person will be a patient, that's a value, a lifetime value of $24,000 for that patient. So again, hopefully you have access to this spreadsheet and you change the numbers to work with your specific situation so you know what your goals, your planning, your revenue, your targets have to be. And then from there, the next tab is the marketing budget allocations. And this is what it's going to look like. We're going to jump back here in a moment. Now, let's say from the previous screen, we said our practice does $640,000. So now here in the annual projected revenue, we're going to type in $640,000. If you want to change this, feel free to do so. Now, what is your marketing budget for the year? You can enter the percentage here. 6% is a good rule of thumb for a typical marketing budget. It's not fast growth. It's more slow or stable. If you wanted to grow, you want to be aggressive with it, 10%, maybe 12%. 3% is too small at conservative. Let's just say I leave it at 10% for easy math. This shows that if your practice is doing $640,000 gross revenue and your marketing budget is 10%, obviously that means your total marketing budget is $64,000 for the year, which equates to $5,300 per month. Now you have the opportunity to break down your $5,300 per month into percentages. What percentage do you want to allocate to online marketing? 85% is a good number. allocated to offline marketing, like billboards or, listed in a magazine, something like that, newspapers, say 10%, and allocated to repeat business, maybe 5%. Feel free to change these. Just be sure that these three percentages add up to 100%. Can't spend more than 100%. Now, here's what's interesting. If 85% of your $640,000 gross revenue, your $64,000 total marketing budget, so your $5,300 per month, it's broken down in this way. Ready for this? In January, your online marketing should be $45,000. Your offline marketing should be $533, and your repeat should be $266. Does that make sense? This is the breakdown of the numbers based on your percentages. Furthermore, if your online allocation of marketing for the year is $54,000, you can break down into further percentages by how much do you wish to invest in your SEO, your PPC, which means management and ad spend, as well as other marketing like display ads or retargeting. The spreadsheet here breaks down all of the numbers based on your actual practice numbers and percentages that you've chosen. I hope all of that makes sense. All right. Finally, the third thing I want to show you, and we'll jump off of the spreadsheet, is that we have the annual marketing calendar. This is a spreadsheet showing you examples of topics that you can utilize for your marketing throughout the year. Down the first column, you obviously have the month of the year, January through December. And then the other columns are pay-per-click ads, email or blog topics, social media posts, SEO focus, and also digital display ads. For example, in the month of February, the PPC ads may be Love Your Health, ads that emphasize a doctor-patient relationship. February is obviously Valentine's, so it's things about love. Maybe an email or blog about fall in love with your health, highlighting the benefits of longer appointments and preventative care. This is just to give you ideas of what you can do to market. And if you think, I don't know what to say, I don't know what to share, I don't know what to write, I don't know what to create, start here and utilize it, and then it'll get easier, I promise. Hopefully that makes sense. By the way, if you do have questions as we're going through this, feel free to put them in the chat. I'll do the best I can to answer them, but obviously we don't have a lot of time, so I'll do the best I can. All right, coming back here. All right, and as we talked about those percentages, under 5% remains static, 6 to 15% is moderate, and 15% and above is accelerated growth. And we talked about that. All right, we finished the goals and planning section. Let's move to section 2, the biggest marketing trends of 2025. I've got about 5 of them. Let's run through them now. First of all, you have to be living under a rock to not know that AI is revolutionizing business and marketing. You can either utilize it and embrace it or get passed by people who do. So let's talk about it. AI tools can be used to create content for your emails, your blogs, your social media, your images, and so much more. One thing that we noticed is that now in ChatGPT, people can search and results come up. For example, I did a search, if you see in these 2 boxes here, this is Google, this is ChatGPT. The search was, I live in Vero Beach, Florida. Please show me recommended concierge medical practices. And Google gave me results and ChatGPT gave me results, and they're not the same results. They're a little bit different. In fact, I'm thinking about doing a workshop in the next few months about how to optimize your website and your marketing to rank more favorably on ChatGPT search. So anyways, that's coming. By the way, this picture and this picture were both generated with AI tools. The next biggest marketing trend in 2025 is online scheduling. If you're not already doing this, you need to. One of our amazing clients is Isaac Emmanuel from Alpha Wellness. And on his website, he makes it so easy for meet and greet appointments with potential patients. There's a button that says, speak with us or meet with us, something like that. They click, it takes them to a screen that looks like this, where people can schedule a virtual Zoom meeting with Isaac. They can pick out the day that works for them. In this case, let's say the 24th, this Friday. Then this calendar tool will show you the different times that Isaac is available, so that the potential patient can say, I'm available at 12 o'clock. They click, they fill out a form, they hit submit. This adds the event to Isaac's calendar, and it sends the event to the patient's calendar. And the systems can even send reminders like, okay, we'll see you tomorrow at noon. Okay, we'll see you today at noon. I'll see you in 10 minutes. Those reminders are available too. If you're not doing this, you need to. The next biggest trend this year is two-way text messaging with your patients. You can give your patients the ability to communicate with your office by text message as well as phone call. Let's face it, everybody texts. People are comfortable texting, and they hate sitting on the phone, and they hate waiting for someone to pick up, and they don't want to be transferred. They want to text, get the message, and get it done. Make sure your office has two-way texting built in. Also, you can use group distribution of text message, what we call broadcast, to do different things. For example, you can send out a group text to inform all patients of time-sensitive news. You can offer specials or promotions to patient leads that haven't signed up yet. And there's many other use cases. Just use your imagination, okay? We talked a little bit about this before. You can have an AI-trained chatbot installed on your website that learns and speaks for you as if an employee, but it's a digital tool. It works 24 hours a day, 7 days a week, 365 days a year. It never takes a vacation. It never has a sick break. It never has a sick kid. It just works. And again, it's trained on your business based on your website and other materials that we feed to it, so that the information it gives to the visitors it's interacting with matches your business voice. It matches your brand, okay? One other thing, be sure to choose a chatbot tool that allows a human to break in and take over the conversation. Not all of them do, so be sure you have that, because there's times you can see the communication happening, and if there's a problem, or you just want a human to be able to jump in, it's really important. One more AI tool that you've got to keep an eye out for is the AI voice receptionist. This is a computerized voice that sounds like a real person and speaks with your lead or the patient and leads them to the response. It leads them to the conversion that you're looking for, to sign up for a meet and greet, to schedule an appointment, whatever it might be. These tools for voice AI are getting better and better. Don't miss it. Keep an eye on that. All right, another amazing tool that's available is using AI to follow up on your leads automatically. And this could be part of a program that's called Marketing Automation. This is where a system is designed, obviously trained and configured for your business, so that when somebody becomes a lead, the information that gets distributed to them is what you want them to see, and it will send them texts, it'll send them emails, it'll put a voicemail message in their voicemail on their phone, whatever it might be. But the idea is to keep giving them information over time without being too annoying about it. Maybe providing, testimonials, or learn about the practice, or something special about your doctor, health or nutrition, whatever it is, so that they're going to get to a point they say, you know what, this practice sounds pretty great. I like what they're talking about. Let's schedule this meet and greet appointment. All right, another super important marketing trend that I want to touch on, authentic educational videos. Now, these are short videos, a minute or two, 30 seconds or less is fine. But the idea is you hold your phone or mount it, you have one topic. What's the problem? What's the solution? How can you help? You take the video, you use some software. There's several available out there like Riverside and Opus, and there's tons of them now, to put the captions on the videos like you see here. And then you take the videos, and with a syndication program like Hootsuite or Publer, you can then distribute those videos out to all of your social platforms, Facebook, YouTube, Instagram, TikTok, wherever it might be. This is an amazing physician, Dr. Ida Khanum. Her business is Pediatric Pod, located in Texas. She records and publishes a video, I think, at least every day, and she gets huge exposure of her videos. Check her out, pediatricpod.com. All right, so we've talked about emerging technologies. Let's now talk about your internet marketing strategy. Second. Okay, thank you, Sharp. All right. This is the patient activity sources pyramid. Your marketing needs to be designed in such a way that it works, and it works by having a solid foundation first, and then you build upon that foundation. Let's talk about these levels briefly here, starting from the bottom, working up, and then we're going to talk about them in more detail in the coming slides. First of all, at the bottom, your marketing foundation. You need to establish credibility with the people who are looking for you or looking at you. So you need to have a professional website that shows who you are, what you offer, and how you're different from your competitors. Its focus is to convert leads into new patients, thereby maximizing your web traffic and maximizing your referrals. Okay? The next level up are active searchers. These are people who are sitting down at their computer or their smartphone, and they're thinking, I need to find a concierge medical doctor near me. I've heard about this DPC thing. I want to find a DPC that has good ratings, whatever. Active searchers are people who are actively searching for what you offer. They may not know your name. They may not know your practice's name. So it's very important that the techniques that we do in the active searchers layer or level of the pyramid are focused on how do we convert the people who are actively searching to come and find you and give them the best opportunity to become your new patient. The next level up is passive. These are people who fit your customer avatar. Avatar is the people that are the right location, the right age, the right interest, maybe the right financial situation, maybe the right industry, whatever it is. There's a certain demographic of patients that you would like to have. For example, some practices like Ida Khanum, who I just showed you, it's a pediatric practice. All of her patients are kids, but she needs to set up her marketing to be displayed to young professional parents, those that want the best for their kids, want a great medical relationship with their physician, with their pediatrician, and can afford it, right? So certain age range, location, and income level. Hopefully that makes sense. In the passive level, the idea is that you want to place ads on the internet that are specifically put in front of the eyeballs of your target avatar audience. It's name and brand recognition. The idea, if they see your practice name over and over time, when it's time for them to either look into it or they said, I started hearing about this concierge thing, what's that all about? Hey, wait a second, I saw an ad for this concierge practice that's in downtown. Let's go find them. They search, they find you. Why? Because you marketed to the passive prospects. And then finally, the little pyramid at the top in purple says on demand. The idea here is when everything's working together, it all works and you have leads on demand. And we're going to talk at the end of this about why you have to do it in the right order from the bottom up. Moving right along. All right, more details about the marketing foundation. I don't want to read through all the words on my slides. I want to give you the main things about marketing foundation. You have to have a great website that's designed to convert. You need a meet and greet button at the top above the fold that people can click and schedule the meeting that goes into your automation program, right? It needs to look great on mobile devices. It has to look great on also desktops, laptops, and tablets, but please make sure your website looks great and works great on mobile. You need to have your Google business profile created, optimized, accurate. If it's not all those things, you're hurting yourself. The Google Business Profile is literally the doorway to your business on the internet. It's the biggest doorway. You have to do it right. Once it's created properly, then you can use different software or tools to syndicate the information of your Google Business Profile out to hundreds of different places on the internet where the same information can be found. Google wants to feel confident that your business name, phone number, address is accurate. And if you only list it in one place, confidence is not very high. If it's listed in 10 places, but some of the information is different, like the street address or some other phone number, if it's not accurate and consistent, confidence is down. But if you have the exact, correct, accurate information and it's distributed over 500 or more places across the internet, Google sees that and says, wow, I feel very confident that this data is accurate. Let's push this ranking higher in the Google Maps section. All right. Reviews are incredibly important. If you don't have positive reviews on your website, you need them. If you have negative reviews on your website, you need to respond to them and make sure that any situations that may have occurred, try to resolve them. Try to get negative reviews removed by working it out with your patient. If you can't, obviously, follow up with a message, respond to it properly, professionally. Don't give away any private health information, of course, but you want to do the best you can and using automated tools to reach out to your patients, asking them to leave you a nice review. All right, and by the way, at Concierge Medical Marketing, we have a proprietary Google Profile SEO service that drastically increases the rankings of a Google Business Profile. If you would like us to explain how that works and show you how it works, happy to do so. Schedule a 15-minute call with us and we'll make that happen. All right, quick talk about the benefits of marketing automation. All right, what's the problem if you don't have marketing automation? The problem is 50 to 60% of inbound website visitors leave your website unconverted. 90% of these web form submissions, when people fill out and click the submit button, fail to convert if they just simply send an email to Gladys at the front desk. Why is that? Because leads that are not followed up within 15 minutes go cold. Not kidding, 15 minutes. Also, the average patient must be followed up with 5 to 7 times typically before they schedule their meet and greet appointment. All right, you need to gently remind them who you are and continue to bring them back so that they will click the button, schedule a time. As we mentioned before, patients prefer to interact with text message. Use it. There's tools available to make this easy. All right, what's the solution? Leverage a marketing automation software package or program so that the submissions are answered within the first 2 minutes by text, by phone call, by email. Texting and voicemail or calling are definitely the most powerful. Make sure that all of your leads are touched more than 5 times over the next couple of days. And do these things, you'll watch your conversion percentage and your practice grow. All right, nobody likes a slide with too much text on it. I'm not going to read all this to you, but here are 12 critical elements that you can implement to improve the conversion of people to your website, to signing up for a meet and greet, to becoming your patient. All right, focus your website content on your target avatar. What are their fears and frustrations? Answer those questions so they feel heard, okay? Use authentic images of your team. Use video of your doctor answering questions. Why choose us? Use video, put it on YouTube and then embed it on your website. That helps with Google ranking. As we talked about, use the AI tools for engaging leads with marketing automation. Use the AI chatbot. Also, include reviews on your website. We call this social proof. In doing so, it helps people visiting see the nice things that other people have said about your practice. And in doing so, they feel better about calling you or texting you and setting up their appointment. All right. Please follow these important website basics. Number 6 here. In the upper right corner, make sure you have your phone number, which is also a click to call on a mobile device, a schedule your meeting or schedule an appointment, something like that button in the top, become a patient, talk with us, whatever you want to call it, and have a button which is a link to your EMR system. Everybody likes that, especially after they're a patient, so they can click, get into their stuff. We've talked about these other things. Boost your credibility by including logos on your website, typically in the footer of, let's say, the Chamber of Commerce in your area, the Better Business Bureau, health grades, any place that can show that you're an upstanding, upright type business and that you have happy patients and a good standing in your community. All right. All right, here's your warning. We're about to talk tech geek speak. All right, please don't zone out. We're going to get through this quickly. Don't stress. Here we go. The next level are the active searchers. We talked about this briefly before. Let's get into the details. Again, active searchers are people who are actively on the internet right now, on Google, on Bing, on ChatGPT, on their phone, looking for a practice like yours, even if they don't know your name. All right. So the things you have to do so that your practice is found by those active searchers include quality SEO, making sure your website appears to the top when people are searching for it. Google pay per click. That's the area at the very top of Google where it says sponsored, and you can pay to be in that place so that you're guaranteed to be there as long as you have a budget and the other practices are not paying more than you, right? Make sure your website is optimized for voice search. Here's a cool technique that you can use AI tools to do, or you can do it manually. Write interesting and relevant blogs. Publish the blog to your website. Then you can take a copy of the URL of the blog post, paste it in your social media profiles. That way, when people see it on social media, they click, they come to your website. Make sense? You can also take the words of your blog and using AI or video editing tools, you can actually turn the blog post into a video. Then you can take the video and publish that to YouTube and Vimeo and hundreds of different places, all that link back to your website. You can have the video in full. You can also slice it up into smaller 30-second short form content and publish that stuff all over the place. With Facebook Reels, with Instagram, with LinkedIn, with YouTube, and tons more places. All of these places link back to your website. All right. Here's a quick note. Do you want to know what phrases that these active searchers are actively searching for on Google right now to find a business like yours? If you don't know that, you need to, and there's tools to do this. We have these tools. If you'd like us to generate this list for you and share it with you, again, no charge, totally complimentary. Let us just give it to you. Schedule a one-on-one meeting with me at cmmkg.com/schedule. All right, more geeking out. I promised you we'll get through this soon. Here are some SEO suggestions for increasing your website's Google ranking. On-page SEO, the things you do on your website to help increase your rankings include creating distinct web pages for each and every service, every medical issue, every treatment, and if you have multiple office locations, every office location. On every one of these content pages, you need to do several important things. Again, tech geek speak, I'm sorry. Optimize your HTML titles, H1 tags, optimize your URLs. Make sure the images are of the right size that they load quickly. Make sure you have descriptive alt tags on every image. Make sure you have unique content on all of your pages. And as I mentioned before, record your videos, post them on your YouTube channel, then embed them back on your website. And you can even grab the transcript of the video and publish that below the video, adding tons more words of keyword-rich content to the page. Here's some more information that you can do with your Google Business Profile. Claim it, optimize it, share it out, and keep adding new citations all the time. Finally, backlinks. You've probably heard this phrase before. What the heck is a backlink? A backlink is a place out on the internet that talks about your business in accurate terms, that links back to your website or links back to a specific page within your website. You need to be sure you're doing backlinks right And when you do it right and incorporate these things, it is incredibly powerful. My little graphic over here says, why is SEO so important? Well, look at this. Half of searches are coming from SEO. Half of the traffic to typical websites is coming from SEO. Every business is different, but that's powerful right there. All right, what is pay-per-click and how to do pay-per-click right? All right, you've heard of PPC, pay-per-click, Google clicks. There's different phrases. Basically, what this means is you're paying Google to put your practice ad at the top of the Google search screen when people type in a search for it. For example, look over here on the right. I did a search on Concierge Doctor New York. There are several sponsored listings. This one, and this one. They are there because Google is being paid by those practices, or in this case, Amazon, to be there. When someone clicks on those ads, the business pays some money to Google. Whoever is willing to pay the most per click and has the most budget, typically their ads are going to be up the longest. It's really, really important that you know what you're doing here, or work with somebody who does know what they're doing, or else you're going to throw your money away and you're going to be frustrated. So here are some very quick tips to make your Google PPC campaign much more profitable. Create a separate ad group for each distinct service you offer. Create distinct landing pages for each distinct service you offer. And be sure to include a strong call to action or a great offer on the landing page. These tips are gold, and here's why. You don't want to lump everything you do together and show the same ad to everybody because people are different. Different services react differently to different people. If one's talking about gut health and the other is talking about, I don't know, exercise or something, that's two different things. If someone's interested in gut health, they see an ad for gut health, they're going to click it and go to a web page, a landing page that talks about gut health. It all makes sense, and you'll have a better conversion of that. And here I am going again. If you need an expert opinion about how your Google PPC campaigns are working, to identify what's working and what's not, and how to save more money per click, again, schedule a time with us. We're happy to look at it and give you some advice. All right, what the heck is on my screen now? All right, we're going to talk about this grid. One final thought about active searchers. Many physicians sit at their desk, do a quick search for their practice, and look at that, they're number one on Google. Fantastic. Okay, so they think, I don't need to do marketing, I'm good. Well, what happens if you do the same search from 3 miles that way, or 2 miles that way, or perhaps from a cell phone on the other side of town? Are you still number one? And the answer 99% of the time is no. For example, if you look at the map on the left side here, everything in red is bad. In other words, really terrible rankings. Green is good. So the area around this medical practice is great for ranking in the Google Map Pack. But once you start getting away from downtown where that location of that practice is, it drops off pretty fast. Now, after doing a proper SEO campaign and a lot of the other cool techniques that we tell you about, this is what it can look like, where everything's green. All right. So no matter where you are in town, you're in the top 1, 2, 3, or at worst 4, 5. All right. So this is important. If you would like us to run this report for your practice, let us know. Schedule a one-on-one with us. We're happy to do it. Okay. I'm done with the tech geek speak. Are you feeling overwhelmed? I am sorry. It's not my intention to make you feel overwhelmed. I know this stuff can feel like a drink from a fire hose. That is not my intention. All right, let's talk about passive prospects, and we'll be coming in to wrap up our workshop today. Again, passive prospects are those people who are not actively looking for your services right now, but they're part of the avatar group, the perfect candidate that if you advertise to them properly, there's a much better chance that they'll become your patient in the future, okay? So it's important that we put your business name, brand, message, reviews, testimonials, all that kind of stuff in front of these passive prospects so that when they think about moving forward, they think of you. How do we do this? We put ads, digital display ads on major platforms like Google, Facebook, Instagram, YouTube, and many, many others, and put these ads on major news and entertainment websites. The idea is that people will continue to see your business, your name, your message, so that they'll choose you and reach out to you when it's their time. All right. This one always makes me laugh. Is the internet tracking me? I went to a website. I looked at kayaks because it'd be fun to go out on the river with a kayak. And now everywhere I go on the internet, I'm seeing ads for that damn kayak. What's going on? Is the internet tracking me? The answer is, well, not really, kind of, but not really. The system is putting a small tracking pixel on essentially your computer, your account, right? The idea is that when you've shown interest in the kayak, then when you go to other places that have ads available to be displayed to you, the ads need to be filled with something. And the system says, oh, they were interested in the kayak. Let's put the kayak ad back in this space. I call it reminder marketing. In the industry, they call it remarketing, also retargeting. But I like reminder marketing because it basically means I'm reminding you that you showed interest in my medical practice. And because of that, I'm going to keep putting my name of myself as a physician and as the name of my practice in front of your eyeballs so that at some point you're either going to get sick of me or you're going to click the button, go to the website and schedule a meet and greet with me. This type of reminder marketing is such affordable advertising because you're only putting your ads in front of the eyeballs of people who've actually already been to your website. Now, as I mentioned before, why does it matter what order we do these things? Why do we have to do Marketing Foundation first? Let me give you some examples. It makes no sense to pay for Google Ads if you don't have a website. Where are you going to send them to, right? Or why invest in SEO on a website that looks like your third grader made it, right? Pay all this money, comes to, it looks terrible, I have no confidence, I'm out of here. And if your practice has a bunch of bad Google reviews that you didn't respond to and hardly any good reviews, why spend the time and money placing ads on Facebook to get people to your practice? Because they're going to look at the reviews. So it's very important. Start with the Marketing Foundation, get that right, get it solid, great website, solid Google profile, get your marketing automation and your reviews in order, then start moving up the layers of the pyramid. Hopefully that makes sense. You got to do it right so you don't throw your money away. All right, now what happens when all these levels are dialed in correctly? Your practice should have a steady stream of new membership patient opportunities. You should be generating at least 3 times income for the amount that you've invested in your marketing. You should be able to focus on your patients and not lose sleep about your marketing, right? That's why you became a doctor, and especially why you became a DPC or concierge doctor, spending more time with your patients, right? Don't want you stressing out about this stuff. Your staff should be happy and productive. Your patients should be happy and experience good outcomes. All right, last part of my presentation today, end of our workshop. How are you doing? All right, how are you doing? Are you like this doctor on the left, looking happy, looking content? Things are good, things are dialed in, we're getting leads, we're growing? Or the gentleman on the right, frustrated, tired, sore neck, stressed out, okay? How are you doing? In your workbook, and hopefully, again, you've all downloaded, printed the workbook. The link is available to you if you still need it. In your workbook on page 13 and 14, we have this checklist. Please utilize the checklist. Go through this, and if you've created your marketing for your practice in such a way that the item is accomplished and working well, put a check mark. And if it's not, perhaps circle it, knowing that that's something you need to get to. This 2-page document in the workbook is gold. It is so helpful. Please utilize it. Please utilize it. All right, as we wrap up our workshop today, what are your takeaways? I want you to be honest with yourself. I want you to determine what area do you need to focus on the most? What did you see today that is the lowest hanging fruit? In other words, well, shoot, we can respond to reviews, or, we really could set up those backlinks, or I heard about that marketing automation software that Dr. So-and-so recommended to me. Let's get that going. What low-hanging fruit opportunities are there? Write them down. Write them down while it's fresh in your mind. Okay? Here's the thing. If you need help, you do not want to go at all this stuff alone. You're welcome to do so, of course. Please take the materials we've created, this training that we've done today. If you are the kind of person who wants to go at it alone, take it with my compliments. I wish you truly all the very best, and I hope it works great for you. But if you're the other kind of person that says, I'm struggling here, I don't know where to start, you don't have to go at this alone, all right? Concierge Medical Marketing is here. We are ready to partner with you to help you grow your practice. All right, I've talked multiple times today about offering you a free one-on-one consultation. Again, how it works is we'll chat for about 15 minutes to get a general idea of your situation, your struggles, your goals, what's good, what's bad, what's ugly. Then we will schedule another appointment for a few days later, maybe about an hour to set aside. And then we're going to dig into it with one of the members of our team so that we can really be sure that we cover all your questions and give you tons and tons of actionable information. What are we going to cover? We're going to give you an analysis of your online visibility. We're going to give you a custom keyword list showing the most important search terms that people are actually searching for right now in your area for a practice such as yours. We will give you a ranking report showing where you rank currently on Google for the phrases that we know people are actually typing in right now. We're going to give you an analysis of online directory listings and the consistency of that information. Remember we talked about taking your Google profile, making it accurate, and publishing it to over 500 places? We're going to look and see if we can find how well your profiles are across the internet. And again, if they're not consistent, if they're not accurate, it hurts your rankings. We're going to take a look at your online reviews and your online reputation. We're going to take a look at your social media presence. How are you doing? Do you have accounts? Are you posting? Or is it a ghost town, right? And we're also going to do an in-depth analysis of your pay-per-click campaigns that you may currently be doing or maybe have done in the past, and see what is the effectiveness of the website conversion. Again, all of this we do free of charge. We want to add tons of value to this industry so we have happier doctors, more successful physicians and offices and businesses, and better patient outcomes. All right? If you want to meet with us for this process, here's the link, cmmkg.com/schedule. One final thought. Do you want a copy of this slide deck? Of course you do, right? There's so much stuff we covered. I need you to be able to take a look back on it later, study it, dig into it, whatever you want to do. Here's the QR code. There's the URL to get to it. Also, in your email tomorrow, we're going to send you a link to this video replay so that you can share it with your team. You can watch it over again, whatever it might be, so that you can be sure to not miss anything. Please feel free to share it with a colleague. Share it on your social media if you want. I don't care. Share it out there because we want to get this information out there. All right? So again, finally, we've already seen this slide, but this is what's included if you want to have a free, no obligation consultation with us. This has been Steve Schwartz with Concierge Medical Marketing. It's been my pleasure sharing the 2025 Internet Marketing Workshop for Concierge Medical and DPC practices with you today. We will send this out as a replay, and you do have access to our worksheets, our workbook, the slides, the whole deal. Please, if you want to chat with us, reach out at cmmkg.com/schedule, and I'll wish you a very pleasant day.